It's exciting, but it's also kind of nerve-wracking because you kind of just wrap your head around all of the nuances that even they have to even go through to just even get to a grocery store.
So we're probably, I think, half a mile from our destination. We're going to a place called C&J Groceries. This is supposed to be one of the few grocery stores in this area, so we're gonna go check it out and see what we can find.
Right, so we just crossed the train tracks over R.A. Dent Boulevard. It is a sidewalk, so that's good. I don't see a lot of street lights, but there are some, which is also good because also thinking about the working class persons, if they're getting off at like 5 o'clock or so in the wintertime, it gets dark at 6. Do they have the proper infrastructure to feel like they can walk safely in their neighborhood back and forth to get from these grocery stores? So that's something to think about too.
All right, guys, so we made it to our destination. We're in front of C&J Grocery, which is actually K&F Wong. So we're gonna go in and see what we can buy for $30 for our family.
It's pretty decent.
What they don't have is fresh vegetables.
We are already counting and trying to figure out what we can put back at this point. We are at $40.23. Okay, so here it is. And unfortunately, we had to put a few of these back.
Went over budget by 17 cents, but it was very easy. As soon as we got up to about $30, we had to ring up everything individually and decide what we wanted, what we could make meals out of, and what we had to put back. And we put food back. It is very hot, and we only have 4 bags of groceries, and we still have about another mile, half a mile to walk. We can see the medical campus in the background. But what did we learn? So the grocery store we went into had almost no fresh vegetables. The only vegetables we did manage to buy were onions, potatoes, and a head of lettuce. Lots of it was preserved stuff, canned stuff, dried foods. But that's what this community has right here.
I saw a lot of the canned vegetables that I would see in other like grocery stores in affluent areas, but they weren't a lot of variety for like low sodium options or less sugar options that you would see in other affluent areas. So I thought that was
interestingly enough, we think we saw one of our patients, which means this was a very real trip. If we saw one of our patients here at the grocery store and they see us at the hospital, like this is their community. And so we're trying to learn about what we can do for our community. All right, we are coming back to family medicine. We're just about to walk in the building. So final thoughts, Candace.
It's a reality, and I think that we've learned, you know, just to put ourselves in our patient's shoes, and we ask them to try to pick out healthy foods and those types of things. And we're talking about different plans. Just keeping it in the back of their mind, and it may not be as easy as we assume that it is.
We tried to buy stuff to make meals out of, kind of. So we have like bread, we have PB&J, we have beans and rice down here, grits because it's easy to make in the morning. You have your eggs for a little bit of protein. We also got some deli meat to make sandwiches out of. As you can see, our protein options are very limited. And then our vegetable options, we found some lettuce, we found an onion and 2 potatoes, and then dairy is our only milk, or milk is our only different product. So it doesn't stretch that far. That's the reality of Augusta's food desert right now.